Hello there, and welcome to the Hit Like a Girl podcast. I'm your guest host, Dana Trampas. We are here live in my hometown, Chicago, for the Power of Women in Medicine Summit, and I'm here with Dr. Annie Andrews. You are a pediatrician, a gun violence prevention researcher, and now a Democratic candidate for Senate in South Carolina. You're also the founder of the Future PAC, the only PAC in the country focused entirely on kids. What a concept. And you're breaking through by saying what most politicians won't. Kids are dying, and we're normalizing it. So you've gone from clinical charts to campaign strategy. Both are very complicated. But I want to start with this. Which one is harder? U.S. healthcare or U.S. Congress? Which one is harder to navigate?
Well, as a pediatrician, in both arenas, I will be dealing with people throwing tantrums and people with poor behavior. Very similar in many ways. Right now, I would tell you the political side is harder. I am still practicing as a very part-time pediatric hospitalist in Washington, D.C. And the days that I get to spend there are refreshing and reinvigorating and remind me why I pivoted into politics in the first place. So honestly, I've been practicing as a pediatrician for 20 years. So that job feels easier than wading into this wild world of U.S. politics, especially in this chaotic political environment we find ourselves in.
And you're also a mom, too, on top of all of these things. So how do all of those roles collide together for you? How do they shape how you see this fight right now?
Yes, I would say being a mom is my most important role. And I know that sounds a little cheesy, but I wouldn't be a candidate for U.S. Senate if I wasn't a mom, because it is my role as a mother that made me brave enough to do all of these things I literally never in a million years thought that I would be strong enough, brave enough, courageous enough to do. My answer to that question, though, is I show up as 100% me in any space that I'm in. There aren't certain spaces where I'm just a mom or spaces where I'm just a pediatrician or spaces where I'm just a politician. It all rolls in together. And I believe the reason my candidacy is breaking through, even though I am a Democrat running in a state where Democrats haven't won statewide in very long, is because I do show up 100% authentically as me, as a concerned mom, as a pediatrician, and as someone who just wants to solve problems. So I guess the roles collide, but they also, whatever the opposite of collision is, they build into something that has made me, in my opinion, very powerful in these spaces that I'm navigating right now.
I love that. They're all intertwined.
Yes.
Inside of you. I'd like to talk about put your physician hat on for a minute. I did a little research about how many physicians there are currently in Congress. Mm-hmm. There's 21, 4 senators and 17 representatives. But out of all of their specialties, how many are pediatricians? Can you guess?
I know the answer to that question. She is a friend of mine, the amazing Representative Dr. Congresswoman Kim Schreier, who represents Washington's 8th District, first pediatrician in Congress. Last Congress, we had 2 pediatricians. Dr. Yadira Caraveo represented Colorado 8. She unfortunately lost her reelection. But I, when elected in November 2026, will be the first pediatrician senator.
Wow. Why do you think, because kids make up a quarter of our population, we don't see people trained to advocate for them in the room? Why don't we have more pediatricians running?
I'm hoping to change that, and I believe that I am changing that because people are watching what I'm doing and they're seeing I'm creating a path for physicians like me, pediatricians like me, to feel brave enough, qualified enough to step into these spaces. There's a really practical reason why there aren't more pediatricians in office, why there aren't more politicians in general who put kids first, and it's because kids don't inherently have political power for 2 reasons. They're under the age of 18, so they can't vote, and they don't have 401ks, so they can't donate to politicians. So as you mentioned at the top, in between my 2 campaigns, I started a political action committee for kids because it is incumbent on those of us who care about America's children, because they're a quarter of our population, but they're 100% of our future. Mm-hmm. It's incumbent upon us to build political power for America's children. That is why I ran for Congress in 2022. That's why I'm running for the U.S. Senate in 2026.
So you mentioned their future PAC. It's the only PAC in the country dedicated to kids, which that alone says a lot. Mm-hmm. Why does this even have to exist? Why does this have to exist now? And what are some of the issues that you might see right now that are kind of slipping through the cracks because we don't have a kid's voice in
That's
the
right.
political.
We have a lot of politicians who speak in platitudes about caring about America's children. We have an entire political party in this country right now who claims they are the party of parents and parents' rights and family values, yet they go to work every day and actively harm America's children. All of the reasons I got off the sidelines back in 2021 to run for office have grown more urgent by the day. The issues that I think about when I talk about building power for children in Washington, D.C. run the gamut. It's hard to even have a 20-minute conversation. My number one legislative priority is going to be to pass a permanent, expanded, fully refundable child tax credit. When we had an expanded child tax credit during COVID, it lifted millions of American children out of poverty. It was an amazing success story that did so much good in a really short time for so many kids and families in this country. And then it expired. And now we don't have enough broad bipartisan support to pass one again. Republican senators voted one down just several months ago. We also need to act with urgency on climate change, which is the most existential crisis our children face. We need to preserve and rebuild our democracy. We need to pass common sense gun laws because gun violence is the leading cause of death for children in this country. And as long as that fact remains true, I will never be quiet about the need to pass common sense gun laws to protect our kids. We need to strengthen our federal Department of Education that is currently being run by someone whose career was spent in the wrestling industry. And they have a very real plan to defund the federal Department of Education. We have culture wars dividing teachers and parents and students, and we have lost the thread on what we need to do to educate America's children. And as a physician, we have to provide more equitable, affordable access to quality health care. And what we're seeing out of this Trump administration and this current Republican Congress is the exact opposite of that. The bill that they passed that will gut our nation's Medicaid program is unprecedented and will devastate healthcare all across this country, no matter if you have commercial insurance or Medicaid or Medicare, because the healthcare system cannot absorb that level of a budget cut and continue to function. I come from South Carolina, where we have a healthcare deserts in the rural parts of my state. We have 14 counties without an OBGYN. We have 5 rural hospitals that are at risk of closure. 6 out of 10 nursing home beds are funded by the Medicaid program. Yet my opponent, Senator Lindsey Graham, essentially wrote that bill and championed it through the U.S. Senate. And it will do real and immediate harm to South Carolinians.
I also want to talk about the big elephant in the exam room. As a mom, I can't wrap my head around having one of the biggest creators of vaccine misinformation as our HHS secretary. I'm sure for you, that's terrifying. Not only as a mom, as a pediatrician, we all know that RFK Jr. was labeled from research that was done by the Center for Countering Digital Hate, that he was one of 12 people that was spreading 65% of anti-vaccine content on Facebook and Twitter. And he's leading the HHS right now. So I just curious to understand, like, having someone like that in office, what is the harm that comes from that? From being a mom, being a pediatrician, like, I guess I'm just trying to still wrap my head around how did we get here?
Great question. RFK Jr. has been really the arch nemesis of practicing pediatricians for decades. He's been up to no good for a really long time. He has profited off of sowing anti-vaccine disinformation that is causing real harm. Children have already died of measles in Texas. Just earlier this week, a young child died in California from sequela from a previous measles infection. So the damage he is doing to our public health system in this country is really just on a scale I cannot even comprehend. I know that even if he got fired today, which he won't, it will take pediatricians and other public health experts decades to recover from the damage that he has done. I lost my race for Congress in 2022. I was very engaged in the Harris-Walz campaign, organizing healthcare providers to support them. I was devastated when we lost in November 2024 and did not plan to run again. But when I saw RFK Jr. appointed to lead the Department of Health and Human Services, I knew I was going to run again. I knew that I had to use my voice, use the skills I've gained as a former political candidate. And I knew this was our moment because this is such a dangerous, dark time for children's health. It's such a dangerous, dark time for public health in general. And what we need is more physicians, more pediatricians speaking up. Too many of us are caught flat-footed. We don't feel comfortable in these spaces where we worry about the consequences of using our voice. But we need to remember why we became physicians and pediatricians in the first place. We need to remember that we're fighting for our vulnerable patients who don't have a voice, particularly our pediatric patients. And now's not a time to play it safe. Now's not a time to be quiet. Now's a time to get really loud. And if someone is telling you to be quiet, whether it's someone at your hospital system or someone in your medical professional organization, you need to ask them why they're telling you to be quiet, and you need to take that as a signal to get louder.
Something that I think is really interesting that I've seen on social media is calling out of those physicians in Congress, particularly One Big Beautiful Bill. Mm-hmm. Let's talk about that. Mm-hmm. As a doctor, you take the oath of do no harm, and yet you may vote for a bill that could create devastation. How are you going to keep yourself grounded in all of this? Because we see that happen a lot of times when people get into politics where they kind of just lose themselves. How are you going to keep yourself grounded?
I just can't imagine myself ever turning into the kind of person who would sell out my constituents, my patients, and families in my home state. I just can't even envision that path for me because I have to go to bed every night and feel good about the work that I do. I have to look in the mirror every morning and feel good about the decisions that I'm making. I think a great example of a physician who has sold out his oath is Senator Bill Cassidy, who voted to confirm RFK Jr., knowing that he was going to do the damage he's doing to our routine childhood immunizations, to trust in public health, etc. I'm doing this for my patients. I see politics as a path to solve the problems I solved for 2 decades at children's hospitals. I'm not doing this to become a career politician. That sounds like a miserable life. I'm not doing this to enrich myself. When I go to Washington, D.C., I will be there for the children and families in the state of South Carolina. And I will stay true to that because that is who I am. And we just need more people like that in office who aren't going to sell themselves to enrich themselves, to keep their corporate donors and billionaire donors happy. We have far too few elected officials who are doing it for the right reasons. And it's time we change that.
It is time we change that. I love that. So for anyone listening, parents, clinicians, physicians, kids who might hear this later, what's one thing they can do now that could make a difference?
Get involved. Get involved in your community. I got involved in a really dramatic way by becoming a politician. We don't all have to do that, but we all need to speak up. We need to return to our community, talk to our neighbors, talk to folks at the grocery store, talk to people in the carpool pickup line, because people are profiting off of our division and our fear and hate right now. And what we see online, what we even see on the nightly news does not reflect what I see every day in my community and when I'm traveling all across the state of South Carolina. So we need to turn away from our screens and turn to our communities. And that's how together we are going to get out of this moment we find ourselves in.
Annie, thank you so much for your work and for raising your voices in spaces where silence has become dangerous. We're going to be watching you and keeping our eyes on you during the election. And we're going to be rooting for kids to have some more autonomy in our healthcare and in Congress. So thank you again for being here. And thank you for coming to Chicago. I'm Dana Trampas with the Hit Like a Girl podcast, live at the Power of Women in Medicine Summit. If you like today's episode, please share it with a friend, tag us. And as always, take care of each other.
Thanks for listening. You can learn more about us or this guest by going to our website or visiting us on any of the socials with the handle Hit Like a Girl Pod. Thanks again. See you soon. Again, thank you so much for listening to the Hit Like a Girl podcast. I am truly grateful for you, and I'm wondering if you could do me a quick favor. Would you be willing to follow or subscribe to this podcast, or maybe leave us a rating or review? Or if you're feeling extra generous, would you share this episode on your Instagram stories or with a friend? All of those things help us podcasters out so much. I'm the show's host, Joy Rios, and I'll see you next time.